Well, good evening, everyone. It's great that you can all join us this evening, and hopefully this will give those of you with an interest in some of our programs within the radiography and diagnostic imaging section of the school a little bit more information. My role this evening is, first of all, just to welcome you all on behalf of our Head of School and Dean of Medicine, Professor Michael Keane. My role within the school, I'm looking at the names in the attendee list, so know many of you recognise many names there. Is obviously I'm working in the radiography and diagnostic imaging section, but as Shane says, I'm also the Associate Dean for Graduate Taught Studies and CPD within the School of Medicine as well. Maybe next slide there, Shane, please. So what I want to just tell you briefly about is I'm hoping this evening you hear about the programs you are most interested in and ask the questions you might have, those burning questions to the members of the team. But beyond these programs you're going to hear about tonight, we currently have over 56 active postgraduate programs within the School of Medicine. And in fact, come next September in the next academic year, that will be closer to 60. We have a number of new programs starting as well. We also have a large number of what we call occasional modules within the school. These aren't programs, so they're not master's degrees, graduate diplomas, or even professional certificates, which are some of the smaller programs we offer. But we do have modules that you can take on a standalone basis. Some of those are offered within the radiography and diagnostic imaging section, and others right across the school that may be of interest to you as well. We currently have over 800 postgraduate students across the school, so a very large number of students. About 250 or more of those are within the radiography and diagnostic imaging section. In fact, I think it's closer to 300 at the moment. So we are one of the biggest parts of the school in terms of postgraduate activity. Next slide there, Shane. So then just to mention to you as well, some of the other areas, this slide just captures some of the different areas of postgraduate activity in the school. And I wanted to flag them tonight because we have had radiographers involved in programs right across the different parts of the school as well. We have a number of programs linked to child health and welfare, some linked to the radiography and diagnostic imaging section, but also some new programs in neurodiversity. If any of you have an interest in the subject of neurodiversity, there's some great introductory programs there as well. We do have some very good clinical and translational research programs, including fully online programs. Any of you who are involved as first aiders or in sports, working as first aiders on sports teams, etc., there are some great programs in our Centre of Emergency Medical Science, which may be of interest to you as well. We have some brilliant programs offered by Asim Sheikh, who's a barrister at law that specialises in medical negligence on healthcare risk management and quality. We've recently launched some programs in primary care, again, two in particular, which could be of interest to radiographers linked to mental health care, but also linked to orthopedics and musculoskeletal medicine as well. We've then got a suite of psychotherapy programs. There was a webinar last night promoting the psychotherapy programs, and we have had radiographers engage with some of those programs in the past as well. So just to let you know, a wide range of programs available beyond what you're going to hear about tonight. So hopefully you'll hear about and find out what you want tonight, but if not, do look elsewhere across the website. And again, on behalf of the head of school, just to thank all of the team who are here tonight, and thank you all for joining us. Thanks, Shane.
Excellent. Thank you, Jonathan. So really on to tonight's programme. So as I said, we're going to aim to keep this short and sweet for you. And we've asked each of our presenters to just present maybe 3 to 5 minutes, giving an overview of their programme. So first up is Adele Thomas, and she's our programme director for CT. So over to you, Adele.
Thanks very much, Shane, and good evening, everybody. You're very welcome. I'm just going to give you a quick overview of the computer tomography programme here in UCD. And this is really a programme that aims to provide contemporary graduate education that will support radiographers in their professional role, and it'll enhance their insight of how the technology works and operates. And that'll really support them in attaining sort of specialist level clinical skills as well. So you can see from, if you just turn on to the next slide, Shane, you can see that the graduate diploma is worth 60 credits, and it actually spans over 2 trimesters from September to May. And the MSc CT then spans over 3 trimesters with a final advanced CT imaging module worth 30 credits taking place the following autumn. So there are two technology and two practice of CT modules. Shane, if you just advance to the next part there, I'll just give you a quick overview of them. The professional practice of CT modules were 20 credits, really focus on things like developing clinical reasoning skills in the student through analysing patient scenarios and through discussing things like justification and optimization of CT protocols and through appraising CT images. So in parallel as well to all of this, students are also doing clinical learning at the same time in their own clinical departments, and this supports their academic learning as well at the same time. So there are two of those, as you can see. The first one there, professional practice of CT1, this really addresses basic CT protocols, because we find that students come in with different levels of clinical CT experience, and this allows a solid baseline of knowledge really to be established in all of the students in the class. And then for the second practice of CT module, we're 20 credits, which is in the spring trimester, and this moves on to more multiphasic CT protocols, advanced imaging protocols, and it focuses on things like modification of practice, tailoring of CT protocols, and it answers sort of how we can answer various clinical questions that are a little bit more advanced. And also we address things like pathology on CT images. Now there are two technology of CT images. You can see each one is there in each trimester as well, the autumn and the spring trimester, and these are worth 10 credits each. And both these technology modules address themes relating to things like scanner hardware, software, image quality, radiation dose and facility management. So in the first one that's on in the autumn trimester, it addresses physical theories and principles underlying CT technology. So things like the X-ray tube, the detectors, slip rings, and all those sort of hardware components in the scanner. It also addresses things like alternative uses of CT technology and principles of radiation protection as well. Now, the second technology of CT module that is in the spring trimester, this focuses a bit more on different scanning parameters and on quality assurance of CT scanners, along with the equipment management life cycle. And the final one that you see there, the advanced CT imaging module, this is at the end of the MSc program, and this module explores things like dual energy, iterative reconstruction, cardiac CT, perfusion CT, advanced applications. So it really is just moving things on a little bit more to more of an advanced level with the most latest sort of developments in CT technology and practice as well. And throughout all of these modules and both of the programs, we do have management and clinical leadership topics that are interwoven into all of the modules. And this really gives students a background as to the operation and the management of a CT clinical facility as well. Thank you, Shane. Can you just move on to the next slide? Thank you. So just some of the unique selling points of the program really are that UCD provides the only professionally accredited graduate CT program in the Republic of Ireland. So the IIRT have approved this program as one that delivers very high standards for academic and for clinical and research skills that are necessary in CT radiographers. And having undertaken this professionally accredited CT program, our graduates have used their qualifications to take on a lot more senior roles or even new roles and opportunities, both abroad and at home, in things like clinical, academic and research roles as well. Now, the UCD CT program offers students with a unique opportunity to get hands-on image processing and image manipulation experience via PACS, or this year we actually used a different online program because we didn't have the normal PACS room we had in UCD. And often in the workplace, there's very little time for CT radiographers to get the opportunity to do 3D imaging. So it's such a busy department to work in, but also sometimes the monitors are in a radiologist's office or somewhere elsewhere like that. So through manipulation of data sets in UCD or under the heading of the CT program, students get this hands-on experience, and they learned about advanced processing techniques and how they ultimately work to enhance the clinical information that's available for a diagnosis from the scans that they have done. Now, the programme also uses a different mix of learning methods. For example, face-to-face lectures, group discussions, e-learning and online material. Now, we've been online for the past academic year, and many students actually have found this a very flexible approach as well to their learning, and they've been engaging well through using breakout rooms and whiteboards online, and it's really enhanced their overall learning experience as well. But we aim usually to have a blended learning approach with a variety of different types of student learning that they can engage with. So why should you take this course? Well, when students undertake this program, they're conferred with clinical competence because they must go through 950 hours of clinical practice during the course of the program, and they must demonstrate the key clinical skills and a high level of clinical competency in relation to their CT practice. Most of the CT programs that are offered are largely theoretically based. And so one of the strengths of this program is that the clinical experience the students are doing throughout the program, it feeds directly into their classes, into their assessments, and their clinical skills are ultimately enhanced as a result. Now, the program also facilitates many opportunities for peer dialogue where students learn about other sites, what's going on in other places, different types of scanners, different types of protocols. So they're able to share clinical practice and to share advice with each other. So that's very beneficial to the radiography profession as a whole, and also very beneficial to the students' individual personal development as CT radiographers. And now the program also helps students to refine their image appraisal and their clinical reasoning skills so that they can make good judgments in relation to what they see on the CT images that they've produced and what the next step might be for the patient, the best next step for the patient. So in the image appraisal session, students work through CT data sets or individual CT images really to enhance their learning of key concepts that they've already covered in lectures. So they might do some lectures and then they'll have image appraisal later on. So it really enhances the learning of the key concepts on the program, especially concepts that link patient scenarios with protocols or protocols with image quality, or simply through reviewing normal and abnormal on CT images. So these image appraisal classes really enhance the student learning experience on the program, and they must work through and problem solve common issues that might arise in work in relation to the images or in relation to protocols. So that's very useful for students as well. Thank you, Shane. You can just move on again. And so questions, do you need a clinical placement to undertake the program? Yes, you do. So students need to organise their clinical placement. Usually they do it in their own hospital. So you need the support of your RSM and clinical specialist and a clinical supervisor for the duration of the program. And people need a bit of experience before coming on the CT program as well. We generally recommend 3 to 6 months. So even if students go in during the summer before starting the CT program, they will have plenty of background CT experience to hit the ground running then at the very beginning in September of the course. So I'm happy to answer any other queries at a later stage, and thank you very much for listening tonight.
Great, thank you, Edel. And I think we might hold, I'll keep an eye on questions as they come in via the chat, but we'll hold any other ones towards the end. We'll move on now to MRI, and the program here is Dr. Alison McGee. Over to you, Alison.
Good evening, everybody. Thank you, Shane. Good evening, everybody. I'm going to present you some information about the graduate diploma and MSc MRI programs, which are offered by the UCD School of Medicine. So both of these programs aim to provide radiographers with very high-level learning experience that helps them to integrate theory and practice issues that relate to MRI, both therefore helping students to develop their and pursue academic mastery, to develop their clinical competence, and also in their own professional development beyond the academic programs themselves. The two programs, they run seamlessly over a 12-month period for the graduate diploma and a 16-month time period for the MSc in MRI. And as you can see, they're divided into a series of modules of study. So during the first trimester, students will engage with practice and technology of MRI. This combination is repeated then during the spring trimester. The summer trimester, the students aim to consolidate their clinical knowledge and practical scanning skills. And then in the final fourth trimester, the MSc MRI students will explore advanced MR scanning techniques and the associated technology through the advanced MR imaging module. So student learning across all of the modules that comprise this program is achieved through their contribution within class, in class discussions and tutorials, through their engagement with various formative online activities, maybe quizzes or discussion boards, also during reflections as they write reflections on their clinical practice, the completion of a practical clinical assessment, and also through the completion of written and oral coursework and examinations. So there are plenty of learning opportunities, and during these, students are encouraged then to not learn in isolation from their clinical practice, but to integrate and apply their academic knowledge to what they do in clinical practice and the challenges that they face on a day-to-day basis. So the clinical learning is integral to both programs. Students undertaking the graduate diploma complete a minimum of 700 clinical placement hours in MRI, and the MSc MRI students complete a minimum of 900 clinical placement hours. So in terms of the module contents then, the two technology modules obviously address the physical principles of MRI, the components and operational characteristics of the MR scanner, the pulse sequence design and their applications in different clinical situations. Aspects of image weighting and contrast characteristics are reviewed. Artifacts are explored, as is QA in MRI, the bioeffects of the MR imaging environment together with safety considerations, the design of MR facilities and various safety implications that might result from that, and also the design of, I suppose, changes to the clinical environment to optimize MR safety. In the second trimester, then, the focus tends to be more on the technology that supports the fast imaging techniques, so fast body MRI and vascular MRI. The practice of MRI modules are based around various anatomical regions. So the very first one that you will study focuses on brain, spine, the ear, nose and throat applications together with the musculoskeletal system. Then the second module will focus on body and vascular imaging, pelvis and pediatric MRI. So in relation to those clinical modules, then you will address the principles of optimization, justification of scanning techniques. You will evaluate the protocols that are used in your own hospitals that you find in the literature, and you're encouraged to share information with each other so we can debate on have a debate on appropriate protocols for patients who present in different clinical scenarios. The clinical practice module is largely student directed within their own clinical MRI department, with supervision from their nominated clinical supervisor and from the academic team. And this is assessed through a practical exam as well as a written image-based exam. And then the final module, students undertaking the MSc program have the opportunity to explore more advanced imaging techniques, not necessarily routinely utilized in many departments in Ireland. Okay, their applications in clinical practice in this country may vary, but nonetheless, students will explore the principles of 3T imaging, cardiac, advanced neuro techniques, breast MRI, etc. And they will view those from the perspective of the technology requirements and also the scanning protocols and evaluate associated image appearances. Within this module, students will also address and explore leadership and management issues as they apply to MRI, and they also will engage in active research through the completion of an audit project. So there's plenty of activities across the various modules that really encourage students to apply their learning to their clinical scanning environment. Okay, Shane, if you'd like to advance the slide. So in terms of some unique selling points of the program, it is professionally accredited by the IORT, so it has it teaches students to a very high level and encourages them to develop themselves. The modules and the content, they encourage the integration of theory and practice issues. So rather than divorce the two, again, this integrated approach encourages a more deeper student learning. To accommodate working radiographers, we found that a blended approach to learning is useful, with a mix of, be it face-to-face or online lectures and engagement in various image-based tutorials and discussions and oral presentations. All of these go to helping students to share their knowledge as well, so that we basically learn from each other. From the perspective of this autumn trimester, we envisage that the programme will be delivered online, okay, at specific dates and times, with a view to then moving to a more face-to-face method in the spring 2022 trimester. So then, looking at why you might decide to take the course, it will help you to develop your clinical competence as an MR radiographer. It will give you the skills so that you can take your career beyond where you currently are, hopefully work towards taking on more greater levels of responsibility, taking on more senior roles within the department. So this is achieved by providing you with a breadth of experience and knowledge, and the development of critical thinking skills to help you on that journey. So thank you very much. I'm happy to again answer any questions. In terms of commonly encountered issues, again, I've included some information there in terms of the equipment students might need to engage in online learning, and I can be contacted to provide more detail on this if anyone is interested. In terms of experience prior to doing the course, we normally encourage students to have a minimum of 4 months practical MR scanning before they start the course, so that it's not all completely new and that the lectures we're covering make some kind of sense, all right? But again, we do appreciate that things have been challenging this year and last year, and we're happy to consider students on an individual basis. And in order to complete the MSc programme or the Grad Dip programme, you don't need to be currently undertaking the full range of MR examination types that are addressed within the programme. Hopefully it might be possible for you maybe to visit a site, if not this year, then sometime next year, to gain some insight into practical scanning of techniques that you do not currently undertake in your own department. But again, this can be discussed with the academic team as it applies, and we can provide some guidance on that. So thank you very much for your time this evening.
Great. Thank you, Alison. And we'll move swiftly on to our next speaker, and that's Therese Hurley, and she's going to talk to you about the ultrasound programs. Therese.
Thanks, Shane. Hi, everyone. I'll get you to move on to the next slide there, Shane, if you don't mind. Thank you. My name is Therese, and I lead the ultrasound program at UCD. The ultrasound program is 16 months in duration, so we have an intake in September, and it runs through to the following December. But in the summer term, you don't have lectures, you predominantly just have clinical placement. It's worth 100 European credits, transfer credits, and it confers clinical competency in ultrasound, and that's probably the most important thing that we take from this, that you have to be able to scan to complete the program. So there's a huge emphasis on clinical skills, being up to date on clinical protocols and practices. There's 3 streams within the program, and some of the modules are common. So everyone studies technology, everyone studies gynae, and everyone studies some management skills within the radiology/obstetrics ultrasound department. Other than within those streams, it's kind of the general stream where there's a split where you do abdominal and then you choose between vascular or superficial structures. And then we have our other stream where you study obstetrics. So it's great because it's huge integration and sharing of knowledge between students from different backgrounds. We build on things, so we start usually with abdominal, with the liver, and we progress on then to the renal system. So studies kind of grouped, linked, building onto the more complex things that are covered in the final semester. The same with obstetrics, early pregnancy up to the full 20-week scan, looking at anomalies and patient management. I'll take the next slide there, please, Shane. The unique selling points of the program: we have highly skilled and competent lecturers. All of us are still in clinical practice. We scan regularly, and many of us have supernumeraries in the large Dublin hospitals. We do get excellent feedback from current and past students. We work really closely with the British Medical Ultrasound Society, trying to develop and ensure that everything is as up to date as it possibly can when we're delivering information to students. Ultrasound graduates are in high demand globally. There's a worldwide shortage of sonographers, and so if you do this course, you'll never be out of a role again. And luckily last year we went through CASE accreditation. So this is a UK-based accreditation body that looks at the quality and content of ultrasound programs, and it's quite rigorous, and a lot of the UK courses would be accredited by CASE, and we're the first course outside of the UK to be accredited by CASE. We're the only ultrasound course in Ireland to be accredited by CASE. Some of our shorter courses are also as well. Why should we take this course? Well, it does focus on practical aspects of ultrasound. We look at a huge amount of imaging, trying to integrate linking theory and practice. Ultrasound's an art and a science. You have to understand what you're doing. You have to have the background knowledge, but you also have to implement it, and ensuring that the students understand the role of ultrasound in patient care and the patient pathway overall. We're very supportive staff. We try to be kind, try to be understanding. Our students last year nominated us for a teaching award. We were awarded that from the College of Health Sciences last year, so it was great for all the lecturers involved. And we do use a range of assessment methods to suit all learners, and that means that we vary from essays to image-based assessments to presentations. So no matter what way you feel that you excel in learning, we will probably hit a box. It's like, yeah, this is my way to do it. We try to appeal to all types of learners by doing that. And so if, everyone will have to do a certain amount of essays and general work, but there should be something there that like students generally really enjoy the program, and we do get really, really good feedback. I'll take the next slide there, please, Shane. And just in terms then of frequently asked questions, we cannot arrange clinical placements for ultrasound. You have to arrange these yourselves, unfortunately. The hospitals are so busy, and it's very time intensive to train ultrasound students. So unfortunately, we can't arrange that for you. And your ultrasound placement, if you are arranging, it has to be in Ireland. Teaching will be a mix of online and in-person teaching, and we'll be developing it in line with public health advice. So if we can teach in UCD, we will teach in UCD. But regardless, we have captured a couple of blocks in each term. All the dates are on the website on the ultrasound page, and you'll be able to see where some of it will be delivered online through the medium of Zoom, and we do try to make it as interactive as possible. So that's all my information there. I think that's my last slide, is it, Shane?
Sure is, yeah.
Yeah, so if anyone has any questions, I'll be happy to answer them at the end. Thanks so much.
Great, thank you, Therese. That's great. And moving on to our the fourth of our MSc pathways, and that is in medical imaging. I'll hand you over to Dr. Michaela Davis. Michaela.
Thank you, Shane. So good evening, everybody. This is about the fifth good evening you've had, I think, in relation to this. But I'm going to talk to you today about the MSc in medical imaging. So this is an MSc program for people who perhaps don't want a specific modality MSc. Next slide, please, Shane. So with this program, it's worth 90 credits, and you'll see that in year 2, you do a dissertation, which is worth 30 credits. And in year 1, you take a module called Research Methods, which is worth 10 credits, and that's compulsory. And then you can choose from a series of modules that are on this slide. So you can mix and match according to your own personal and professional interests. So you can see here, there's some technology modules, there's radiation safety, there's cross-sectional anatomy, there's Dexa. And you'll see at the bottom, we have a suite of modules, suspected physical abuse, which was formerly non-accidental injury. So this is related to injuries in children. This is a very interdisciplinary module, and this will look at radiographers and other professionals' responsibilities and interactions with children. We have another module, legal, child welfare and protection, which again looks at the radiographer and clinician's responsibility in relation to children that you're imaging or you come across with child protection issues. And we have legal responsibilities in child protection. Now, legal responsibilities looks, as it says, like at the responsibilities as a practitioner that you have. But one of the selling points of this module is that you get the chance to write a report for court and to give evidence in a court with solicitors and be cross-examined by solicitors. So this is the closest you'll ever get to being in court without actually physically being called. So the last 3 modules are very interactive, and you learn alongside a variety of other professionals, such as police, teachers, nurses, doctors, and other clinicians. Next slide, please. So the unique selling points of this program are that the program is actually built around the student. So you can mix and match modules that suit your own personal and professional goals at this particular time. And the modules are delivered in a variety of formats. So as this year, it's pretty much everything's been online, but some of the modules are delivered online. Some are delivered via a mixture of blended learning, which might mean one-day attendance in UCD, and some of them, the modules are delivered by attendance, but it's very different depending on whatever module. Why would you want to take this course? Well, the selling point of this course is it's ideal for busy practitioners that have like family and work commitments. And the course is built around the student. So you can study the modules that you think are more useful to you at this particular time. And you can apply them to your own personal and professional practice. You also have the ability to study in your own country. So there's not necessarily a need to come to UCD, depending on which modules you want to take. And you also have a chance to apply what you've learned in your own country. So a lot of the assessments are very relevant to what you're actually doing. And for the dissertation, you've got the chance to research something that you're very, very interested in relation to your own personal and professional practice. Next slide, please. So some of the frequently asked questions are, do you have to physically attend UCD for all of the course? And no, you don't. Can you study while working full time? And absolutely. So the majority of the people that take this program are working full time and they've got busy, home family lives. So it's totally doable. Do you need to take modules from outside the university? No, you don't. So there's some information here on the link here that you can follow up if you wish to. There's my email address if you have any questions, and I can take some questions at the end as will all the other panelists. So have a think about it and get in touch if you're interested. Thank you.
Great, thank you, Michaela. So that's a kind of brief overview of our 4 main MSc pathways. So as you probably know, MSc programs tend to have about 90 credits associated with them, which can be a mixture of academic and clinical subjects. But most of these 4 pathways you've seen also have a graduate diploma associated with a small amount of credits, so a bit less work or a term or 2 less. So we're now going to move on to our diplomas and our certificates. And we're going to start with our graduate certificate in interventional imaging. And Marion Maher is going to speak to you on this. So Marion.
Thanks, Shane, and hello, everyone. You can actually move on to the next slide, Shane. So I look after the graduate certificate in interventional imaging in practice, and it's been running now for about 8 years. It is a 30 European credit transfer program, so it's got 30 ECTS associated with it. That's of 4 modules, which you can see here: radiation safety, cross-sectional anatomy, patient care and interventional procedures, and the technology of IOR itself. It's delivered over 2 terms, so it commences every year in September. The first term runs to December, and in that term you cover radiation safety and you cover cross-sectional anatomy. In the second term, from January to May, you cover patient care and interventional procedures and you cover the technology of IOR. A lot of the modules here, they were designed so that students can have a look, can learn a huge amount more about the area they're working in, and possibly use that information to see how their services run themselves and to have a greater understanding of the service that is provided to patients in IOR. If you could move on there, Shane. So I suppose what's unique about this program is it's the first one in Ireland in interventional imaging. It's also the first one in the UK and the only one still in the UK or in Europe. So one of the unique points is that every year we have quite a significant number of our students come from international backgrounds, from the UK, from across Europe, from Singapore. So it has gathered a lot of traction internationally, not just at home here in Ireland. Probably one of the reasons for this is that it's delivered 100% online. All of the lectures are pre-recorded and updated annually, and they're released on a weekly basis. And you can look at them at a time that suits you. You can replay them. You can make your own notes. Notes accompany the lectures. There's no commitment to attend UCD. The content is taught online, and it's also assessed online. So it makes it very useful, I suppose, for clinical sites where it is very difficult to release students to come to UCD. This program, there's no commitment to come to UCD at all. So you do it as and when it suits you. There are a couple of interactive tutorials throughout it. So throughout some of the modules, we will have live tutorials, sort of like this evening, where we will have a discussion group and we'll prepare you for assessments and things like that. So again, there's no new content delivered through these, but it is a useful discussion point, and you get to know that you have a bigger learning community out there. It was designed for radiographers to undertake because up to this, there was no postgraduate education in interventional. So it is designed for radiographers who work in interventional, who want to know a lot more about patient presentation, the types of procedures that are happening, the prognostic value for each of the procedures, the outcome for the procedures, to look at consent, and that's kind of a changing environment, to look at radiation safety. IR is becoming one of the greatest burdens of radiation in radiology, to look at disease progression, etc. So it really does delve into kind of I suppose, a multidisciplinary content across a number of the modules there. If you work this course is designed for radiographers who currently work in interventional. So a lot of the assignments are based on your own practice and reflecting on your own practice and evaluating it, and just coming up with case studies from it. So it is ideal for those radiographers who are just starting in interventional, or perhaps have been working in interventional for a number of years. Okay, Shane? It's held every year, so it starts September annually, and successful candidates finish in May. And actually today I just signed off on all of the recent graduates. So every year it's an annual program, runs over 2 trimesters. It has been, I suppose, the most common question I get asked is, what happens if I fail? To date, we haven't had any fails, and certainly it's not a program, none of our programs are set up for students to fail. So all of the assessments are appropriately designed. There's a lot of support given. There's whilst we are delivering it online, and it is remote location you're studying from, there's a lot of support from all of the lecturers, all the module coordinators, the program director. So you're not on your own, and your learning is supported, and it's tailored, especially in years like this year where clinical pressures have been unprecedented, for want of a better word. All dates and deadlines can be negotiated in accordance with clinical pressures. Excuse me. So I think I've covered the main points there. And again, I'll be happy to answer any questions at the end. Thanks, Jane.
Super. Thanks, Marianne. To our professional cert in radiation safety, and that's to Shauna Murphy. Shauna.
Hi, can you hear me okay there, Shane? Just to make sure.
Can indeed.
Great, you can move on to the next slide, please. So I'm just going to talk briefly about the professional certificate in radiation safety. So we've had lots of interest in this course over the last couple of years, thankfully. So what is it, or what's the course overview? So it's a 10 credit or a 10 ECTS credit module. It's 4 months in duration. And the stuff or things that you'll learn about in the course are physics and the units of radiation and dose measurement, methods of dose reduction, and radiation safety guidelines and best practices. So it's tailored specifically to professionals working in the area or working with ionizing radiation, and specifically for people who want to maybe improve their knowledge of radiation safety and best practice guidelines. So you'll also develop a deeper understanding of national and international legislation governing radiation safety in your own country, whether that be Ireland itself or internationally, and understand how you fit into this as a professional and how to apply it effectively to your work life. You'll be able to critically evaluate radiation safety policies and procedures in your profession and understand your role within them, and hopefully examine current issues in radiation safety and apply these to clinical and industrial decision making and problem solving processes as well. Next slide, please, Shane. Thanks. So what are some of the unique selling points of the program? So it's a part-time course and tailored to the working professional. Okay, so that basically means that a lot of the assignments and submission dates for these assignments are on evenings or weekends. So it allows the students plenty of time to complete them. Most of the content, so it's completely delivered online, and most of the content is timed in such a way that it allows the student as well plenty of time to catch up on the actual material itself and then complete the assignments within good time. So we haven't thus far anyway, no students have, or well, we found that students have had plenty of time to complete them, and they haven't been under time constraints that we're aware of anyway. It's completely remote, it's completely online, and can be completed anywhere. Obviously, you need access to reliable broadband, but the timing, I suppose, at which you complete the tasks is up to yourself. The assessments, however, are timed and should be submitted within a certain time frame, and that'll all be communicated to the student when they commence the course. So another unique selling point is that it's currently the only professional certificate program in radiation safety that I'm aware of anyway. I couldn't find any other. So we have quite a lot of students coming from all over the world to complete, which is great as well. We also have lectures that are created by and delivered online by leading medical and industrial radiation safety experts, as well as some academic experts in physics. Again, another unique selling point is that it's completely assessed by continuous assessment, so there's no actual end of semester exam. So like I said, just timed assessments, and the student will be given those dates of assessment when they start the course. So why should you take the course? So you should take it if you want to improve your knowledge of radiation, radiation safety and legislation, to understand better your role in radiation safety and develop skills and knowledge to become a better radiation safety officer or radiation worker, and to be able to effectively apply this knowledge and skill in your role for effective problem solving. Next slide, please, Shane. So eligibility is the next one. So this is quite a commonly asked question, actually. So you should have, one of the following should apply. So like I said, we do have students from internationally, lots of students, but also students from lots of different backgrounds. So because it's a professional certificate, one stipulation is that the student should be currently employed in a role in which they use ionizing radiation, and that's governed by radiation safety legislation similar to our own in Ireland, but it doesn't have to be that one exactly. Also from clinical background, so you should have one of the following. So they are a BSc in radiation therapy or radiography, sorry, a BSc in physics or equivalent. If you're a member of the Medical Council or on the register of the UK General Medical Council, an individual named on the register of dentists held by Dental Council of Ireland, if you're a nurse registered with on board alternate, or if you're a member named on the register of Veterinary Council of Ireland, or the members of the Royal College of Veterinary Surgeons. Or next slide, actually, Shane, please. And then last one in that category is if you should have a good standard of education, minimum of leaving certificate or equivalent, with evidence of ongoing training in the area of radiation safety and professional experience in the field utilizing ionizing radiation and operating under current legislation, okay, which is in Ireland it's SI 256 or SI 30. But like I said earlier, if you are in a country with equivalent radiation safety legislation, that's sufficient, okay? But the reason being that this is a professional certificate, so we kind of expect that the students should have kind of some bit of prerequisite in it. But then all of the following should apply, okay? So the student should currently be employed in a facility which uses ionizing radiation within the state regulated and licensed by the Radiation Protection Institute of Ireland or similar regulatory body, or licensed facility internationally. They should demonstrate a commitment to continued professional development within the realms of radiation protection, and you should have some level of computer literacy and have continuous internet access for the duration of the program. Now, don't be put off by the words computer literacy, okay? It doesn't mean that you need to be a whiz, but because obviously it's completely online course, you will have to engage quite a lot with with the module online, but of course I'm available throughout the whole course for any help that you may need. Okay, and also obviously UCD have quite a lot of help in the IT department if you're finding it difficult. So then last slide, please, Shane. So just some frequently asked questions again. So how long is the course was asked quite a lot as well. I kind of said it at the start anyway, but it's a 4-month course, so there's two offerings, one in January and one in September. Okay, so 4 months each. Another question, I suppose, leading on from that is, can I start the course when it suits me, or when can I start it whenever it suits the student, basically? The answer is no, unfortunately, because the course has the 2 offerings and the assignments are timed and due at certain times during the course, it is necessary for the student to pick one or the other of the 2 starting dates, so either January or September intake. But other than that, there is a lot of flexibility around the course. Otherwise, like I said, it's tailored for the working professional. So we do allow for quite a lot of time for assignment submission. Okay. Can I still use an on-campus facility? So because it's all online, obviously there is no requirement for you to attend for any lectures, but you can still use the facilities on campus, and they are still available to you because you're still a student of the college. So you will have access to all amenities during the course. So if you have any questions other than those, I'm happy to answer them at the end, or you can email me at that address there.
Great, thanks, Shauna. We're going to move on to our next program, which is our professional cert in Dexa, and that's over to Ailish McDermott. Ailish.
Hi, Shane. Can you hear me?
Can indeed.
Great. Apologies. My Zoom won't. I can't find my camera just now, so obviously it's maybe giving me a hint not to turn the camera on today. So
no COVID haircut, no.
Never. So yeah, I'm glad to have the opportunity to just talk a little bit about our Dexa program. So it's a professional cert in Dexa imaging. It's a 10-credit module, and it focuses on Dexa in the clinical setting. It's carried out over one module, so it's delivered over a 12-week period. Historically, we have run this module in the autumn trimester, but it's now being moved, so it will run every spring trimester is the plan. So this slide just gives us a kind of an overview of what we cover in the course. We think it's really important. Sometimes Dexa is a modality that maybe hasn't been covered kind of historically, or it's been quite a while since somebody has worked in it. And so we like to cover the physical principles and a little bit about how the system works, just in order to give kind of some theory into the background of how the Dexa scanner works, so you can use it to the best of its of your ability and what it can offer your service. And we also cover scanning and analysis techniques in relation kind of with best practice standards, but also on how to apply these, because when we work in individual settings, different patients present, and so it's learning how to interpret those best practice standards with kind of the cohort of patients that we see. We also look at vertebral fracture assessment. Now, this isn't something that's routinely done in every Dexa service, but it is fast becoming an important kind of tool to be used alongside the BMD measurement. And certainly the Royal Osteoporosis Society are very anxious that vertebral fractures be kind of taken into account when looking at a patient's bone health, and they're putting a big push on that. So kind of understanding how to carry out that assessment and also how it can add to your result, we cover that as well. And probably one of the more important aspects is looking at serial scanning techniques and how we can apply best practice guidelines. For the most part, if somebody is attending for a Dexa scan, it will be to look for at their bone density, their bone health, and probably they will return and we will want to see if there's a change. And so in order to know if there's, the change is real, and we do have to be sure that our service and our scanning is consistent and it's reliable, because otherwise any changes then can't be deemed to be true changes. So that's something that we certainly look at in some detail. The next slide. Okay, so the unique selling points of this program. So this program has been designed and has been offered online historically. So before we all, had to dash to Zoom because of the current situation, we had developed this module to be offered online, because we certainly understand the challenges that there are to get away from busy clinical environments. And so the content of this module is delivered, the lectures are already recorded with notes, and they're released at 3 different times over the 12-week program. And it's very much student-led. It's up to the individual student how they would like to approach their learning. For some students, they like to put an hour or 2 aside each week. Some students like to spend, a full day or a weekend. So we, very much encourage the students to decide which approach works best for them. Obviously throughout the 12 weeks, and especially as the content is released, I'm available always by email and for any questions. But we also, because we understand that when you're learning online, it can sometimes feel like you're learning on your own. And while independent learning is great, we also really want to encourage you to be part of the Dexa imaging team. There are, few people that are, have experience in Dexa imaging. So we do like to get together for tutorials. Again, they're not mandatory, but they do allow the students to get together as a group with myself, and we can talk through, some of the questions that have come up on the content, or even the application to the individual clinical settings, how we might best approach different patients and situations. So definitely another selling point is that I really like to try and, create a team building approach. And just to put those that are working in Dexa in touch with each other, because it can be quite a small field. There isn't clinical placement required for this module. It would be great if you could, go and observe a scan and maybe observe the analysis, because it is a slightly different type of imaging that you may be kind of used to or have experienced previously. So that would be helpful, but you don't need to be scanning as you're taking the module. And so that's just probably something that's important to know. Again, we're aware that sometimes when people start working in Dexa, there hasn't been the time to develop that theoretical background. And so that's what we like to do, is to, give our students the theoretical background so that they can apply it to their real, real clinical situations. So you don't have to have worked in Dexa previously either. That's not a prerequisite. Just the willingness to learn and learn a new modality is great. The assessments are particularly developed to help you apply your knowledge to clinical settings and clinical environments, because essentially at the end of the day, that is what we're trying to encourage, that clinical practice is based on best practice, with kind of as much knowledge as can be gained. Like I said, there is no time, there's no on-campus time. You don't need to take, none of the lectures are as such live. They're pre-recorded lectures, so they are available for the students to undertake at a time that absolutely suits them. And when we do have our live tutorial, we do try and schedule that for a time that suits those that are, that want to join. Probably just something that's important to say is that this module is open to those working in various healthcare settings with a background in healthcare. But it's important to know that completion of this module does not as such give the student permission to operate a Dexa scanner. That's very much underpinned in the legislation. So while it will give you the theory and the background, it doesn't actually give a license or an allowance to scan if you're not one of the those mentioned within the legislation. So that's just something that's probably worth pointing out. So if there's any questions, I'd be happy to take them now, I think, if we've reached the end.
Great. Thanks, Eilish. We're going to go on to our final programme for tonight, just before we finish, and that's our grad cert in Obstetric Ultrasound. So over to Mary Moran. Mary, can you hear us?
Yep, can you hear me now?
Yeah, perfect.
Perfect. Thank you, Shane. And apologies again for not having access to my video. So I'm just basically going to talk about the graduate certificate in obstetric ultrasound. This program is 18 months duration, so it's a year and a half to complete, and it's equivalent to 30 European credits. And basically what this program does is it confers clinical competency in ultrasound for obstetrics at a fundamental level. And that's where it's quite different to the MSc program, with the MSc program obviously conferring competence at a higher level. There's 4 modules that are associated with the program. Each one takes 6 months to complete. So the first module is early pregnancy ultrasound, and this takes place every year from January to June, and it starts off with a study day in UCD in January, which is has compulsory attendance associated with it. The second module then is fetal biometry, liquor and placenta, which is sort of a basic second and third trimester ultrasound. And this takes place between July and December, so follows on from early pregnancy. And there's also a study day then associated with this module, and that's in July. And again, there's compulsory attendance. Now, obviously this year these have been virtual, but normally that second study day actually takes place at the National Maternity Hospital or at the Coombe Maternity Hospital, with live scanning of patients in the afternoon. And then depending on, like a lot of those who will take this module will be NCHDs that will be moving around their clinical placements every 6 months. So depending on what your clinical placement is, then the third module would either be fetal wellbeing ultrasound, which is sort of more, looks at more sort of structural abnormalities, etc., and more slightly more detailed second and third trimester ultrasound, or a gynae ultrasound module. So obviously, depending on where you're going to be working and which kind of ultrasound you're going to have better access to, you would choose one of these two modules for the third module. And again, these take 6 months to complete. So Shane, if you could move on there, please. Thank you. Okay, so associated with the program then and these modules, we have some other offerings, and they are for those who want to just take early pregnancy ultrasound. We have the professional certificate in early pregnancy ultrasound, which is exactly the same module, again, compulsory study day in January and runs from January to June. We have the professional diploma in obstetric ultrasound, which is the first two modules. And again, both the two compulsory study days and runs from January to December. Or we have a professional diploma in early pregnancy and gynae ultrasound. So again, that would just be the two modules, would run from January to December, and it would just be the one compulsory study day then in January. And then the other offering that we have for those who have actually completed the graduate certificate, so they've completed 3 modules, they can then take as a standalone professional certificate the module that they did not take as part of the full grad cert. And those modules start in January and July every year. Okay, Shane, if you could move on. Thank you. So I suppose the unique selling points of the programme is, first of all, as I said, there are the 2 compulsory study days, but otherwise all the lectures are delivered via the online platform. The lectures are put up every week, and then when all lectures are up, they're left up then for the full duration of the module. So obviously students can have a look at these lectures and go through them at their own convenience and at their own time. And a lot of the NCHDs would find they would do this maybe when they're on call, for example. All clinical practice then and all assessments are undertaken in the student's own clinical site. So in order to be accepted onto the programme, you must have a clinical placement and also have a named clinical supervisor in your own hospital site. And I suppose this flexibility, as more than with the master's programme, has absolutely given us fantastic feedback from current and past students. And, you know, I would already be receiving lots of sort of emails and inquiries about the program starting in January. So, you know, the sort of way the program has been run and the flexibility does seem to really suit a lot of students. So who should take the program? Well, as I've sort of alluded to already, OBS and gynae trainees at either SHO registrar or SPR level, and indeed we've had some consultants who've done the program as well. General practitioners also, and again, some hospitals are very good at taking GPs on board to train, and others maybe not just haven't got the facility to do that. But some, you know, some general practitioners have completed the program. And then also midwives and radiographers who perform ultrasound in the antenatal clinic or in the emergency room. Because again, as I say, it is a more basic course than the master's. But also those who have an interest in specialising in OBS and gynae ultrasound will quite often take the masters. And interestingly, our current master students, of those that are taking the OBS stream at the moment, they have all actually completed the grad cert in the past few years. So it was their way of kind of getting into ultrasound and seeing if they actually were interested and liked it, I suppose. So Shane, if you could just move on to the last slide there for me, please. Thank you. So again, unfortunately, as with the masters in ultrasound, we cannot arrange clinical placements for ultrasound. So this is something you have to organise yourselves. Because again, it is a certificate course, the clinical hours are between 80 and 90 hours. They're obviously over the 6 months. That's obviously the minimum number of hours, but that roughly equates to about 4 hours a week. So what you would need to have done is to have a clinical placement arranged, if you like, 1 morning a week. You know, before actually taking the course. And we don't accept anybody onto the program until they have a form that's actually signed by themselves and their named clinical supervisor. Okay, so that's it. So again, any queries, there's the email address there, and as with everybody else, I'd be very happy to answer questions. the end now.
Excellent.
Finished.
Thank you, Mary. So that's it. Wow, that was a quick fly through a number of programs.